Aloha! This is Dr. Sally of Doc Sally Jungle Medicine Podcast. And today, what we're going to do is actually do a real, somewhat simulated but actually authentic introductory first visit for a naturopathic medical visit with our lovely volunteer, Grace, who is going to actually present real issues. So, and you guys can see what an example of a naturopathic primary care intake could look like. They're all different every time depending on what someone's needs are, but some things are universal. So, are you willing, Grace? Are you ready to go?
I am willing. I am ready.
Okay.
I am consenting.
All right. So,
let's do it.
First thing I have to ask you is, have you ever seen a naturopathic physician before? Do you know what you're getting into?
No, I haven't actually.
Would you like the 50-cent tour?
Yeah, let's do it.
So, a naturopathic physician is the third kind of primary care doctor in the United States. We have the same type and scope of training and licensure in the states in which we're licensed as a medical doctor or an osteopathic doctor. We go through similar types of training. How we are different is in two things. Mm-hmm. One, our philosophy of care is different. And two, the toolboxes that we use are overlapping but different. So our philosophy of care, I'm going to share it with you because I think it's going to help you understand why I asked some of the crazy questions that I ask. So I brought a prop.
Perfect.
Okay, so these are the principles of naturopathic medicine, and this is what informs our practice and how we do what we do. The first one, I'm going to skip the Latin. The first one is respecting the healing power of nature, which means basically our goal is to figure out what obstacles to health you have that are unique to you and how we help you get those out of your way, and then your body heals itself. So we do not heal you. The second thing is to identify and treat the cause, and to me that's the core one because it is the difference between what we're doing here versus what would happen if you went to a regular medical practice most of the time. It takes longer to treat the cause, it takes longer to find the cause of an illness, but when you do that work, you remove the obstacles and the person just blossoms. So that's what we're mostly trying to do here. The third one is do no harm, which MDs have that one too. Seems kind of obvious to me, but allopathic medications kill hundreds of thousands of people, and we try to avoid that. So we prescribe medication. We have the capability of prescribing most medications. But for me, it's more of a last resort, not the first option. But you do have that choice. So, and then the last one is docere, which means doctor as teacher, which means for this part of the interview, I talk a lot, but not the whole time. Okay. And then the last one is treat the whole person, which means that we try not to specialize. We try to look at everything and then make a picture of you that you need to you and treat that. Okay. So, my first question for you is what is going on with your health that you would like to be different?
So, the biggest thing that I've been dealing with probably the longest, gut issues. So, I oscillate between being constipated and then having diarrhea and then like somewhere in between. And sometimes not even twice a day. Sometimes it's a lot more in the day. Sometimes it's like once a day. I also get migraines and have ever since I was a kid.
Ooh, when did they start?
Probably when I was about 11.
When did you get your period?
11, I think, around then. Yeah, and so the other thing also is that I have really inconsistent periods that are often very, very painful, where I usually get a migraine. I have severe cramps where I can't really move. Often I also am getting nauseous from the pain. So those are the main things.
Those are big.
They're big things.
Yeah, and they're all related.
Yeah.
Very, very interrelated. Okay, a couple of detailed questions about this. When did the gut issues start?
When I was like 15, I remember crying because I felt like I couldn't eat anything. I would try to eat something and I would feel sick. I would try to eat something and after a few bites I just couldn't, it wasn't palatable anymore. I went to a nutritionist, I went to doctors, and really everyone was telling me your diet's perfect. There's no reason why you should be feeling this way.
What was your diet?
Honestly, not that great. I was eating a lot of eggs. I was eating bread pretty regularly and like organic, whatever, but I was eating gluten pretty regularly. But then, you know, chicken, beef, just meat, a lot of fish, because I grew up on the coast, and vegetables, cooked. Usually I didn't eat a lot of raw vegetables. Generally, like raw greens or salads upset my stomach, I notice, or it's hard to digest. Beans and rice, dairy.
What made you feel the worst of all these things? Could you tell?
Definitely the gluten and eggs, even though it's what I was craving all the time.
That's how allergies work.
Yeah.
We crave the thing that's the worst for us.
Yeah.
You, since at least age 15, you're talking about cramping, diarrhea, constipation. Was there also bloating and gas?
Yeah, bloating and gas as well.
What kind of gas? Okay, let me give you the options.
Yeah.
I saw that look. Okay, there's silent but deadly. Like, okay. And then there's like large volume, low odor, like blow up a balloon.
Yeah.
But less stinky kind. Those are the two main kinds that people report.
Alternating.
Okay.
Yeah,
confusing.
both. Very confusing.
SPD, and how soon after you eat would you start feeling discomfort? Like the next day, right away, a few minutes, you said after a few bites?
Yeah, sometimes right away. Especially with the gluten and the eggs.
Okay. Have you had an allergy test?
I have done one of those in-home allergy tests. I hadn't been eating gluten for about a year when I took the test.
Oh, well,
or eggs.
Accurate. Okay.
I was like totally vegan, gluten-free when I took the test, but egg whites did come up in the test as an allergy.
After a year? Are you vaccinated?
No.
No childhood vaccines?
Well, childhood vaccines, probably all of them, but no COVID vaccine.
So some of those vaccines can create pretty persistent egg allergies because egg albumin is used to make some of those vaccines. So you're injecting a protein in a way that your body's not recognizing it, and it goes directly in the bloodstream, and that's one of the ways we get allergies. Those are really persistent allergies, but we have a program called low-dose immunotherapy that can help turn that off. So what I'm going to do now is start you a little treatment plan, and I'm going to put a little handout about low-dose immunotherapy on it so you can take it home and read it, because this seems like a multi-step plan is in order for you.
Yeah.
So far, nothing that is not internally consistent. So I like it when someone's story is internally consistent and the things that are causing it, the multiple symptoms seem to lead to a common cause that we can go, oh, let's address this common cause. So far so good.
Okay.
As far as I'm concerned.
Yeah. That's good to hear, because to me it feels like all over the place.
Course. Because if you're inside the fishbowl looking out, it's you can't even tell there's water sometimes. So. Do you know what low-dose immunotherapy is?
We've talked about it before, so I know just through you generally. And I was also curious if we could do it for my cat allergy.
Of course we can.
Yes.
The answer is yes.
Yay! Yeah, because
yeses.
I really don't want to be allergic to cats anymore. It sucks.
I know, cats are wonderful.
Yeah.
So Dawn's first LDA treatment was for cat. And it was purely selfish on my part to even get this training, because I was in love with a man that was severely allergic to cats, and I wanted a cat, and I was not taking no for an answer. So I hear about this, I take the training, I give him the thing, and long story short, his cat allergy gone. Now I have 3 cats that live with me and sleep in the bed. Okay, so if we're going to prep you for the LDA or LDI is the version that I do now, but low-dose allergy therapy is also wonderful. That was invented by Dr. Shader. All kudos to Dr. Shader, he's amazing. And the version I do more frequently now was invented by Dr. Ty Vincent. So that's the one I'm going to prep you for.
Okay.
It's really important to have your vitamin D adequate and your zinc adequate, and at least just a basic smattering of the nutrients to make sure your body can actually learn new information and heal. Okay, so we do it in the context of a healthy diet, which sounds like you may already have. And you want to minimize exposure to the things you're highly reactive to just the day before the treatment, the day of the treatment, and the day after. So 72 hours. Now, if you are highly allergic to something, you also usually crave it. So for some people, that 72 hours is just like, way inflamed stress ball out of all proportion, and they won't do it. Okay, so then I just say, fine, do the best you can, just take less of that food. And that seems to help it work.
Okay.
Some people, like severely autistic kids, they'll eat, like I have kids that'll eat nothing but Cheerios, you know. They get the food obsession thing, and they will not go off the diet, and we treat them, and about 75% of the time it makes a significant difference anyway. So if you cannot avoid, like for example, if it's mold and you live in a moldy house, we treat anyway. If it doesn't take the way we want it to take, then we get the next round, we do it about every 7 weeks. Okay, the next round we get a little bit more concerned about avoiding trigger things.
Yeah. That's something, too, that might be important to know. When I was 13, the house that we were living in, we found, like, loads of black mold in the house. So
did things get worse then?
Yeah, I was, like, sick all the time. I had respiratory infections and sinus stuff going on.
So we're definitely going to treat you for mold as
well.
And is your environment for mold clean?
Is my environment clean of mold now? I would say probably not, just considering how humid it is here. I do my best to keep everything clean.
Okay. When you go away, like go to the mainland or go someplace dry or go to, you know, Burning Man or something, and you come back, do you get an exacerbation of symptoms when you leave the area and then come back?
Well, I haven't left the island since I moved to this area.
Let's go back to the migraines. So you get them not just premenstrually, you get them other times?
It seems very random to me, but I could probably attribute it to stress. Working a lot, not having better boundaries with myself. I do look at a screen a lot for my work. If I don't get very good sleep, or if I sleep weird, I also get a lot of tension in my shoulders, my neck, and in between my shoulder blades.
Ow.
Yeah.
Okay. Yeah.
So I notice when there's a lot of tension there, it also increases, my headaches.
What's your magnesium intake?
I'm not taking any kind of supplements currently.
Because 80% of American adults tested were found to be deficient in magnesium, and that's even according to like an AMA MD level. That's not even like, we have different standards for what ideal is. The RDA standards for vitamins and minerals are generally set to a level to avoid a frank disease state from that deficiency. They're not set at a level to optimize health. So at the point where you would get scurvy without it is what they set the vitamin C level for. And that's, let's 60 to 200 milligrams-ish, for example. But an average animal of your body size would make at least 3,000 milligrams a day in their own body. So how we correlate how much you need of these things is all over the place. But even by their standards. And that is directly related to what? Muscle tension and what? Migraines. So we should make sure you have that on your plan somewhere.
Okay.
So migraines, let's go back to that. What do they feel like?
Oftentimes I get just like a pounding sensation on this side, like right in my temple, where it feels blinding. So it's in the side of my head, it's behind my eyes. Sometimes it's also just both sides, but it's in the temples and behind the eyes.
Do you know what a prodrome is?
No.
Okay. Prodrome is one of those cool words. It is something that happens before something else happens consistently in a pattern. So before someone gets a seizure, for example, they may smell burnt popcorn in the air. That's a prodrome. Pre-migraine of a certain kind of migraine, some people will get vision changes, wavery lines, euphoria, irritability, smell changes. They'll get something like that lets them know the pain is not here yet, but the pain is coming.
Yeah. Irritability, definitely.
Okay.
And sight changes. Like things start to just get a little bit fuzzy. But I've also noticed that sometimes when I get migraines, the only thing that makes the pain manageable is like watching a movie. If I close my eyes and I just try to sleep or I just try to lay there, it intensifies.
Well, that makes perfect sense, because pain awareness is very, very dependent on your attention to it.
Yeah.
So that's one of the reasons that people can do hypnosis and then do like surgery without anesthesia. We can do amazing things with how we perceive pain with our mental awareness and focus. So if you're just taking your attention away from it, you're going to perceive it less. It doesn't mean that it's actually the disease is better. It means your awareness is less.
Yeah.
So instead of doing drugs, you're doing distraction.
Yeah.
Do you take anything for this?
No,
Have you tried
generally.
What have you tried for?
I've tried ibuprofen.
Okay.
Which sometimes helps, but I don't like to take it.
Okay, so is it that it doesn't work very well, or is it that you're opposed to medication?
A little bit of both.
Okay.
I would say, yeah. I'm generally kind of opposed to medication unless it's absolutely necessary. And sometimes, especially when my head is hurting and I can't think straight, it's hard for me to tell, is it necessary or not? Like, to what extent? If I just watch a movie and I sleep it off the next day, will I be okay?
Does it last about a day?
Sometimes it lasts longer. Sometimes I will have them for 2 to 3 days.
And you can't work? Yuck.
Yeah.
And how bad on a scale of 1 to 10? If 10 is, I need to go to the ER right now because there's no other option. And 1 is, I feel nothing.
Maybe like 5 or 6.
Okay. And it's a pounding, any other quality, like a pounding sensation, throbbing?
Throbbing, pounding. Sometimes it's sharp, like it just feels like someone has like a knife in my temple. And then there's like pounding and throbbing with it.
How often would you say that this happens before or during a period? Like, do you get these every period?
Usually right at the start of my luteal phase, or like a couple days before bleeding, I'll have it, and sometimes it'll last a day or two. But sometimes I do get them during follicular phase.
But you said periods are really irregular for you. So
Yeah.
how do you know this luteal follicular? Are you tracking it somehow?
Yeah, so I use a basal thermometer and I track with my temperature. I have an app that logs all of my data. I've been using that for 2 years.
Okay.
Yeah.
Have you checked your thyroid though? Because thyroid dysfunction can make that completely unreliable. What are your average body temperatures?
I'm gonna have to turn on my...
Are you tracking ovulatory mucus? Or are you just tracking periods?
I'm generally tracking my mucus. Like, I don't really make a point to track it, but I just kind of notice.
Are you ovulating?
I've been having this cycle where I'll have 2 super irregular cycles where, like, it's just taking me a really long time to bleed, and I'm not ovulating. So I'll have like two cycles of not ovulating, and then I'll have a normal cycle. Let's see.
So long, like how many days?
Sometimes it is like 47 days.
Whoa.
Yeah. Sometimes, on average, it's more like 35.
Estrogen dominance is severe. Okay.
I even had one that was 59 days.
Wow.
Yeah. And ovulation was detected for that on the 48th day.
Because of the temperature change.
October of last year. My most recent cycle was 31 days. My period was 3 days long. I had 1 day of just like spotting, and I did detect ovulation on the 20th day.
On day 20.
Yeah.
All right, and you're cramping all the time.
Generally, I would say more often than not. I did have a weird cycle, a weird bleed, not this one, but the one before, where I had no cramping, and I barely bled. I bled for like 2 days, and it was super, super light. Let's see.
It doesn't sound like a period.
Right.
It sounds like ovulatory spotting, possibly. Tell me what your diet is right now. Like, what did you eat in the last day?
Okay. Oh, the last day has been a weird day of eating.
Everybody always says that.
I've been, it's like not been a regular time of eating because I've been feeling like just total aversion to most foods the past couple of days. Yesterday, I literally had half of a sandwich from Island Naturals with smoked turkey and...
A gluten sandwich?
No, gluten-free bread. I also had a smoothie that morning, which was just bananas and peanut butter. And then for dinner, I had some potatoes, yellow potatoes, and like a couple of bites of baked chicken. And that's all I could really eat. Oh, I also had some rice and some carrots with daikon and onion and garlic and bone broth.
Okay. So you're generally an omnivore dietarily right now.
Yeah.
What does this aversion feel like? Like if you eat, you get nauseous?
If I eat, if I eat, I get nauseous, or if I think about eating, I get nauseous. And I'll, be like, I'm probably nauseous because I haven't eaten anything, right? Mm-hmm. So I'll go to the fridge and I'll just try to put something together, and I just, can't.
Does anything seem appealing? Like, would fruit seem appealing? Like, would mango sorbet seem appealing?
Yesterday, at the start of the day, it was like nothing was appealing, and I was feeling really frustrated.
So this is worse in the morning. Do you wake up nauseous, or do you wake up hungry?
Lately, I've been waking up just not hungry.
Mm-hmm.
But in the past, throughout my life, I usually, if I wake up earlier, like around 7, I wake up so hungry. Like I have to eat something, or I'm shaky.
That's a healthier state than you're in now, but I'm sure your health is devolving digestion-wise. It's getting worse, not better. Because a normal, healthy human being wakes up hungry because their circadian rhythm and cortisol rhythm triggers that.
Yeah.
So if you are having all kinds of problems like blood sugar fluctuations overnight, if you have a blood sugar drop overnight and then you get adrenalized during the night and you sleep through that, that adrenaline tells the liver to dump glycogen sugar into the bloodstream. So your blood sugar is adequate or even high in the morning when you wake up and you're not hungry. Okay? And then there's also gallbladder effects going on there too. Bile being dumped at the wrong time makes people intensely nauseous. So a lot of this comes down to possibly low stomach acid. Ha! See? You knew we were going there. Which is a stress response. It's a response to any kind of stress. So lifestyle stress, situational stress, or physiological stress. Trigger it too. So the hormones being off is a stressor to your body. So the gut being off and the hormones being off are synergistically making each system worse.
Yeah.
It's really yucky, but fixable. Have you had any kind of testing of your digestive system? Have you had parasite testing? Have you had SIBO testing? Have you had digestive analysis? Anything?
Yeah, so I came in to see Dr. Unity actually 3 or 4 months ago, and we did whatever we could do with insurance. Stool tests, I can't remember exactly what I got tested in this moment. But yeah, we did a bunch of blood tests, hormonal panel, and...
What did that say?
She had one concern about my testosterone being slightly high, just barely high.
Yeah.
And then gave me another order to go back and get another blood test, but because my cycle has been so irregular, it's hard to pinpoint when to actually go within that window, right?
Have you had an ultrasound of your ovaries?
So I've had 2 ultrasounds of my ovaries, and the first one was such a traumatic experience, to be honest with you. It was terrible. I got the ultrasound because I got an IUD, a copper IUD, and I was having pain for 6 months and spotting for 6 months. And so they said, okay, go, get an ultrasound. I didn't know it was going to be an internal ultrasound. Nobody prepared me for that. I have sexual trauma. So that was already kind of traumatizing, and the nurse wasn't very attentive to that or supportive. And then literally after the ultrasound, she came in while I was still putting my clothes on, and she's like, come out here right away as soon as possible.
What?
I'm like, what's going on? So I walk out. She's standing there with 2 other male doctors. I don't even know who they were. And she's rushing me down the hallway. She's saying, you have to go back to your gynecologist right now. Don't stop anywhere. Just get there as soon as possible. Rushes me out of the hospital. I get to my gynecologist, and they're like, we don't know anything about this. Then the hospital was refusing to fax over anything about my ultrasound and telling them that they've never faxed with them, even though they had been working with them for 25 years.
What?
The OBGYN decided to just take out my IUD. And
because they didn't know what was going on.
They didn't know what was going on.
Okay.
And I never got anything from the hospital except for a bill.
Okay.
So that was the first time I got an ultrasound.
Okay, so if we could just talk about one of the reasons people come here is that I'm wonderful. But another reason people come here is because the conventional medical system is doing things like this to people more and more and more. And that kind of trauma story, unfortunately, It's not the first time I've heard something like that. So we'll never know what she saw. Did you get better after the IUD came out?
Yeah, the pain went away, but the weird thing was later that year, I started getting really severe pain in my lower left abdomen down here. Like 3 or 4 times it happened, to the point where I was driving and I thought I was going to pass out. So I had to pull over and could not move. You know, just like keeled over in pain. And this happened a few times where I literally had to miss work because I couldn't even get to my phone to like contact anybody. And so I went back to the gynecologist. I did another ultrasound, and basically they said, well, we see one cyst on your ovary, but it was on the opposite side of where I was having the pain. The other thing they said was just that my I was just like really full of poop.
Okay.
And at that time I was still eating gluten, and I was still my diet wasn't as good, and I was feeling constipated that day.
Bowel distended.
Yeah.
Okay. Did you do laxatives? What did you do for that? Did it get better?
I don't think I really did anything, but just went home feeling more confused, because they said basically all we can do is put you on birth control and see if that helps. And I said no.
Okay, wait, so they found a distended bowel and they want to put you on birth control.
Yeah.
It doesn't make sense.
It doesn't make sense to me either. They said you should probably go see a specialist for that. I ended up going to a doctor, and they said, well, we can put you on, we don't know what's going on, we can put you on stomach liners.
Stomach liners? You mean like omeprazole, like a proton pump inhibitor?
Yes, I think so.
Did you do it? You didn't do it.
I didn't do it. No, I didn't do it. I said no to the birth control and the medication they were trying to give me, and I never got the pain after that, like that same pain. So I just went on with my life.
Was it during ovulation or right before a period or during a period that you got these consistently? Can you remember? Was it related to a cycle or just random?
From what I remember, it was kind of random. It was a different pain than what I get when I cramp.
Do you get more migraines when you are constipated versus having the diarrhea? You said you go back and forth.
Yeah.
Over a course of days to weeks between one to the other extreme?
Yeah.
Okay.
The migraines I feel like I usually get when I actually have more diarrhea or like loose stools. And when I say diarrhea, it's like just very loose. Like it'll come out looking kind of solid, but it's not.
Like snakes.
Like snakes.
Okay, here's a weird question. Do they float or sink? Your stools in general?
Generally, they kind of float. Yeah.
I knew it. And is there any mucus in there? Any blood? Any undigested food? Anything you recognize?
Sometimes undigested food, like quinoa. Which I don't eat.
What to do with you.
Oh, yay. I love to hear that, because no one has ever said that to me.
This makes so much sense. It totally makes sense. Oh, you poor thing. Okay. Quinoa. So when Dr. Unity did your testing, I really want to see the test because she and I look at them differently.
Yeah.
But the stool test didn't come up with any parasites or infections.
No.
That's probably what she's screening for. And that's stuff like Campylobacter, Salmonella. That's like major, put you in the hospital type infections. Is kind of the filter they're using if it's a general stool test. So stool test negative for infection, and we'll look at it to make sure. But for now, I'm assuming in parasites. And I'm going to tell you that I've actually put a squirmy worm in some poop in a sample and sent it to the regular lab, and they told me no parasites. So their parasite test is, I don't know, if a monkey threw a dart at a board. It's just ridiculous. So yeah. I don't trust that there's no parasites there. So our rule out has to include considering that, because this pattern also goes with eggs being laid, and the parasite cycle changes as the parasites do their thing. So one of the reasons people can get alternating constipation, diarrhea, cramping, bloating, etc. is parasites doing their thing. Have you noticed any itchy butt? Does it get worse on a full moon? Anything like that?
Not itchy butt, but I do sometimes. It hasn't happened in in about a month or so, but the skin around my vaginal opening gets like super itchy and like irritated, and it's not a yeast infection because I've gotten tested for it. When that happens, like everything looks normal, and it doesn't even, like, nothing looks red, but it feels like there's little like cuts.
Oxalates. Do you have any is it discharge or just the tissue itself?
Sometimes,
do you get a weird discharge?
Sometimes I get kind of like a creamy discharge.
But that's been tested and
it's not yeast, yeah.
Okay.
And I'll do, sometimes a suppository, and it doesn't go away.
Because it's not about an infection.
Yeah.
So if you have oxalates and you have vaginal irritation from oxalate deposition, that is one of the areas that can happen, unfortunately. And it looks and sounds like that. Okay. And people will be tested over and over for UTIs or for yeast or for bacteria or for Gardnerella, and it's all those tests are negative, so we can rule that out. Some women get irritable or have allergies or have responses to semen, and it causes irritation in the vaginal area. And so friction wouldn't trigger it, but semen would. We can do low-dose immunotherapy for semen. I have had couples that have had terrible problems because the wife's allergic to the husband's semen. And we actually do a semen sample, and we send it out, and we have a low-dose immunotherapy remedy made for it, and we give it to her, and voila, poof, no more vaginal irritation.
Wow.
Marriage saved, marriage counselor canceled. I mean, it can be, it's not common, but it happens more often than you would think. Yeah. And vaginismus is one of those symptoms that people just don't talk about, so they don't even know that this is possible for it to even happen, much less know that there's a cure for it. The other thing you're describing here is possible oxalate deposition. That's one of the tender bits, is one of the places oxalate, you know what oxalates are. Those lovely sharp shards. And they are in a lot of food. So one thing we could try is a low oxalate diet for a while. And it sounds like you need one anyway, because it looks to me, we're going to do a physical exam next, but I'm thinking that we need to rule out SIBO. And the SIBO treatment diet is also ipso facto a low oxalate diet. So, they often come in clusters together. It's not, you don't just have one or the other. You're usually blessed with more than one. So we're going to say rule out SIBO next. It sounds very uncomfortable to be Grace.
Yeah.
Just in general, like this is a lot.
Yeah.
Of low level, high functioning, but really frustrating dysfunction.
Yeah. And I've been dealing with all of this for a long time.
Well, you're only 24, so long time to me and long time to you is different.
Since I was like
so
12 or 13, you know?
Yeah, that is a long time.
It's a long time for the lifetime that I have lived so far.
So as long as you have been even close to an adult or been an adult, you have been miserable.
Yeah.
Physically.
Yeah.
At least part of the month, if not all of the month. How many migraines in a month, on average month, would you get?
I would say probably average 2, and sometimes they're lasting more than one day.
So how many days a month are you feeling this?
Probably maybe 5 or 6. Yeah.
That's a lot.
I mean, some months I don't have it at all.
Okay. Can you tell what sets that up? What's different about the preceding month where you don't have any
stress?
Okay, so your adrenals are shot. Let's flip that around. Instead of saying stress causes things, do you have in your life more than the average amount of stress? Or
like stressors? Like
yeah.
I would say honestly my life is pretty dang good.
Okay. So agreed. So if you're in a situation where activities of daily living and the normal variations in stress that people should be able to buffer, you can't buffer. And so any excess amount of stress, even within the realm of normal, is triggering migraines. If we turn that around and look at that, what that means is that your physiological buffering systems, your coping mechanisms are not intact.
Yeah.
And that is the goal, is to restore them. Another way of looking at that is saying what's going on with your adrenals and your thyroid. Because the adrenals and thyroid are sister glands. They interact with each other a lot. And if the adrenals are going down, pretty soon the thyroid starts to go down. So when we do your physical, we're going to look at some thyroid stuff and some adrenal stuff now. So let's look at thyroid, adrenal, and tummy. Is there anything else intake wise that you think I should know? Let's do it this way. Let's kind of run from your head down and kind of just think of it like we're detectives and we're looking for clues.
Okay.
So it may seem weird or trivial to you, but if it's a kind of a clue, it's still worth noticing, okay? So anything with your head, you told me about headaches.
I definitely get a lot of tightness, just like right at the base of my skull.
Does it come and go with stress? Or
It's pretty constant.
constant?
Neck, like head, neck, and shoulders, mid-back is pretty consistently painful. If I had to rate it on a scale, probably about like 5 most days.
Does anything make it better or worse?
Stretching can definitely, like consistently doing yoga can help it come down to maybe like a 4 or a 3, but it doesn't make it go away. And it's like I have to be very, very consistent with it to even see anything, and oftentimes even just going through that process is very painful.
Have you had adjustments, chiropractor?
Yes.
Okay.
I used to go to the chiropractor when I was in North Carolina, and that changed a lot for me. I've been in a couple of car accidents, but none of them were very serious. There was one where I had a little, whiplash, and I went to the chiropractor for that.
Here's why it matters so much. Your head is anterior on your shoulders pretty significantly.
Yeah.
And your shoulders are rounded in like this.
Yeah.
So all of that is constructed to put a lot of pressure on the vagus nerve.
Mm-hmm.
Vagus nerve is the one that comes down through here, and even a little bit of dystocia can press on it. It is about the vast majority of your parasympathetic nervous system signals go through that nerve.
Yeah.
Those are the ones that help regulate digestion, right? So if the vagus nerve is impinged, you're never going to get a non-stress signal. You're always going to, because it's the one that says relax. So you're not getting the signal to relax physiologically if it's impinged. So this is one of those issues where structure matters to your healing outcome. So let's get your tushy to the chiropractor.
Yeah, okay.
Or if you cannot afford it and you don't want to do it, I have a little stretching routine I can send you home with that is probably going to be more bang for the buck of your time effort than yoga.
Yeah.
Not that yoga is bad, but yoga is not designed to correct this kind of dysfunction specifically, and the stretch routine I'm going to put on your plan is.
Okay.
So likely both would help. Do it in front of a mirror, do it with a friend, do it so I can see it the first time, because what happens is people attempt to do what he's asking them to do, but their imbalance is carried with them.
Yeah.
So it doesn't do any, if you're like this and you stretch around like this and you never get to this, it doesn't help much. So when you first do it, a clue that you're doing it right is that it's brutally difficult and you can't finish 13 minutes. If you breeze through 13 minutes with your type of pain and 5 out of 10 pain every day, you're doing it wrong. Okay? Because what happens when you have a fixed pattern like this is the muscles that are holding it get hypertrophy, they swell and get too strong, and their balancing muscles that are supposed to do the other half of the motion that you're not doing anymore, they get weak and atrophy. So now all of a sudden we're telling the weak muscles to work, and they don't know how anymore. So they're going to be like, what? Okay, so you should only be able to do a few of his stretches at first, and then that muscle should actually get weak and watery. You have to take a break. That's how you know you're doing it right.
Okay.
Okay? So, and if you need more help with it, let me know.
Okay.
But this is easy. Plus I know you need magnesium. We're going to start down here. We're going to start a list of suggested things to find either in your diet or in supplement form. I prefer diet. I prefer dietary concentrates. So I prefer to use food concentrates when at all possible. They're lower dose, they work better. If you're going to use an isolated, chemically derived high dose vitamin, it acts more like, has more of a drug-like effect. And sometimes we need that. But for foundationally, we start with whole foods. So back to
the scan.
This syndrome that you're describing with the muscle inflammation as a trigger is also a trigger point for creating this cluster headache migraine thing too.
Yeah.
It's part of the thing about it is if your problem had like one cause and you're a smart gal You probably would have stumbled across it, figured it out, tried it, done it. So far, you have at least 4 different, very important causes for migraine cluster headaches. We're probably going to have to knock all 4 of them down for them to go away completely. So we're probably going to implement a thing, get a partial response, implement another thing, get a partial. We're probably going to work at it to get those 4 causes that I'm seeing so far down, but they're all doable.
Okay.
Let's do her physical, and then let's talk about labs, because the type of labs you were able to get from her are definitely better than nothing, but probably not enough to diagnose anything. Like, she didn't come back and say, aha, I know what's wrong with you, let's do this, right? She kind of went, well, it's not this and it's not that.
Yeah.
You are showing a lot of signs and symptoms of progesterone deficiency and estrogen dominance, which is a pattern where even if progesterone is testing in normal range at a certain time, the estrogen is so imbalanced high in relation to it that it creates a functional deficiency symptom. So that's a little bit trickier to diagnose. Blood tests are not great for progesterone diagnostic because, well, progesterone's a fat, and the liquid part of blood is water-based. So oil and water don't mix very well. So progesterone tends to pulse through the blood, get carried to the tissue, and be deposited. So it comes out in pulses. So depending on when you draw that blood, you can get varied results in the same day, the same person. So if you rely on them too much and you ignore the symptom picture, you miss a lot of stuff.
Right.
And the sex hormones are like that. The stress hormones a little less so. But the best testing for someone with this picture is a saliva test, where you drool in a tube, or you pee in a cup.
Okay.
So we're looking at what your body used and excreted. It's like asking someone what they ate, where they going and looking in their garbage can. Going, aha, ding dongs. You didn't mention the ding dongs. There's a ding dong wrapper in there, right? So I would prefer to do urine testing here, and I think we can find some that are reasonably affordable, like in the $100 to $200 range for a hormone panel. So we'll set you up for that. And then you get a kit that goes to your house. You pee in a cup at your house. You send it to the lab. They send us the results. We go over it. So we're going to set you up for that.
Okay.
It sounds also like possibly, in addition to estrogen dominance, that you might have PCOS. Has anyone told you have that?
Dr. Unity said that there's a potential.
Yeah.
Because of the high testosterone and because of the length of my cycles.
So
and also
get
facial hair.
I was just going to say, do you get facial hair?
Yes.
Ha.
Yes, and I always have, and it's gotten worse.
Ha. Okay. Yeah. Okay.
Yeah.
So PCOS with estrogen dominance is more complex to treat. So we really, really want to get good labs before we start throwing hormones at you or dinking around with your hormones. However, working on your liver's ability to break down hormones is going to help no matter what. It sounds like there's some liver congestion, liver toxicity going on. The liver is responsible for taking all these. Let's say you have a cyst, or your ovaries are just making too much of a hormone at a certain time. Who breaks that down? The liver breaks that down. So if your liver can't keep up with production, you get this excess that builds up. And so a safe bet is to go, hey, what's going on with the liver? I'm assuming she did basic liver testing. So, but I'll know when I see the labs. I want you to look at the low progesterone symptoms and see if this resonates for you, okay? Anxiety.
Yes.
Okay, just throw a number out.
Okay, like 6.
Yeah, that's a lot of anxiety. Yeah. Okay. Problems worse from ovulation to just before or the first day of a period. You already said yes to that. Increased heart rate.
I'm not sure.
Okay. So the symptoms can overlap, and also other hormone imbalances can affect this. So increased heart rate only is but if your thyroid is starting to kick in and be sluggish, you'd have decreased heart rate. So maybe not.
I don't really track it.
Right. Irregular heart rates. Like being aware of your heart stressing.
Yeah, in moments where I feel maybe like stressed or anxious, I notice that.
Panic attacks, which is basically severe anxiety with heart rate stuff.
Maybe like once every 3 months.
That's a lot.
Yeah.
Headaches, cluster or migraine. We already talked about that. Low libido.
Yes, very.
Okay. Swollen, painful breasts or nipples. That can come and go.
Yeah.
Okay.
Definitely.
Moodiness or mood swings. Yes!
Yes!
I'm backing away from the table slowly. No, it's okay because you're in follicular. I can come back to the table.
I'm good.
Thank God we schedule it during follicular. Okay. Fuzzy thinking or brain fog.
Yes.
Okay. Food cravings, or if severe, can switch to don't want food.
Yeah.
See? Didn't you just tell me can't eat anything?
Yeah.
This probably gets worse as a cycle progresses for you, I would guess, if you were to track it that way. But not always. Irritable, especially under stress.
Yeah.
Restless sleep or wakes in the night. The older you are, the more that kicks in.
Yeah.
Growth hormone at your age is probably so high that you may not notice that.
Yeah.
PMS cramps, you already said.
Yes.
Like, huge. Waking.
My weight has been pretty consistent most of my life. Up until about a year ago, I gained like 12 pounds.
A year ago, you suddenly gained 12 pounds.
Yeah.
And haven't been able to lose it.
I haven't really been trying to lose it. But,
okay.
yeah, I mean, it hasn't just...
It hasn't come off naturally.
Away.
Okay,
Yeah.
so we really got to make sure thyroid's screened well for you.
Okay.
Spotting between cycles. I'm thinking that might have been the thing that happened to you with the 2-day painless thing.
Could have been
That's
that.
no schmerz can be.
Usually, I've never had that happen to me before, otherwise.
Okay. Painful joints. You just talked about that. Yes?
Yeah.
Asthma. Now or as a child? No.
No.
Vaginal irritation. You already said you had that. Acne or rashes.
I had bad acne. Now I get like small little ones around, my chin. But I have always consistently had somewhat cystic acne on my shoulders. Yeah.
That's the PCOS element.
Okay.
So that's more the testosterone imbalance, less the progesterone imbalance.
Interesting.
Right. Okay.
Yeah.
Although progesterone can turn into other hormones. So it can be confusing.
Okay.
Depression, anxious depression.
Yes, absolutely. I get anxious and then I get depressed about the fact that I'm anxious.
Lovely.
Yeah.
Frequent urination. More than 8 to 12 times in 24 hours is frequent. Just to give you a frame of reference.
More than 8 to 12. Maybe like more than 8 every once in a while, but
okay, not a big deal. Painful periods, duh.
Yes.
Pain and bloating in the lower abdomen before periods.
Yes.
Okay, so you have like 90%. 80 to 90% of the low progesterone symptoms.
Wow.
Shocker.
Wow.
Huh? Yeah. Okay, so next I'm going to put on your plan a little bit about what progesterone is, why we need it. Every cell of the body needs progesterone. It's not just a female hormone. It's not just a sex hormone. It is actually, we think, the first hormone, the progenitor hormone from which and so eukaryote bacteria make progesterone. So every cell in your body needs progesterone. So if you're low in it, it affects the downstream effects of that are huge. And so we need to pay attention to it. It got named progesterone because it was first found in a uterine lining when people were first in finding things. It was a very exciting time. Okay, so if you kind of scroll through your body, are there any other parts of your body that are saying, hey, I have an issue, think about me, you didn't talk to her about that? Is there anything else that's saying, pay attention?
Yes. And something, okay, so I always would have, when I was younger, would have issues with my tonsils where I wasn't getting strep, but I would get tonsil infections pretty frequently. And when I was in high school, I had like some kind of tonsil infection for like over a month that no one could figure out, and none of the antibiotics were helping.
So you need an ASO titer. Okay, we'll add that in. There's a situation called PANDAS, which is pediatric neural, I can't remember the acronym. It comes on after a severe strep infection, but it can also come on after another severe onset adolescent infection.
Okay.
And it's a neuropsychological symptom set. So anxiety, depression, gut issues. First of all, you're on antibiotics for a month. So your gut's a mess now, and it's set up to continue to be a mess from that. Yeah. Then the infection can cross-react with bits of your nervous system. So now your immune system's attacking your nervous system. So it creates kind of an autoimmune-like inflammation that goes chronic.
Okay. Gotcha.
ASO titer is one thing we can do.
I will chew on my lips and my cheeks. And I thought that this was crazy and I was the only one who did it, but I learned recently that it's a thing.
Like, when do you do it?
To just like have that sensation, but it's like the repetitive behavior and something about doing it, it feels good.
Pandas. Didn't we just talk about pandas?
Yeah.
So pandas causes tick behavior.
Okay.
Self-soothing, repetitive motion behaviors and tics.
Yeah.
That is classic PANS. Do you know when it started? Was it after the infection?
I remember picking at my lips even when I was like 6. So maybe even before then.
Okay. When did you get this? I was in high school. The month-long infection.
Yeah. Yeah, I was like 16.
Any other self-soothing repetitive behaviors that you could think of?
If I have something like this, I'm always like twisting it or folding it, or if I'm sitting in grass, I'm like picking the grass and tying it together, just like trying to do things with my hands. I will sing to myself or hum to myself as a soothing thing.
There's a lot of physiological anxiety going on when you do that kind of thing. I'd probably like to do a couple of focused physical exams on you, but at some point, a full naturopathic physical exam takes like quite a while. We've already been at this a while. You're probably pretty tired, so let's do a couple of focused things and then circle back and maybe record that another time.
Okay, that sounds good.
All right, we're moving.